to jump off, you'll be able to hear the recording at a later time. So give me one moment.
This meeting is now being recorded.
Welcome everyone, I'm Ashley Klein-Jimenez from Prevent Connect, and you are joining us for our web conference session today titled, How Do We Connect the Dots? Local Approaches to Preventing Multiple Forms of Violence. Prevent Connect is a national project of the California Coalition Against Sexual Assault and is sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided on PreventConnect.org and our activities do not necessarily represent the official views of the United States government, the CDC, or CalCASA. So I'm really excited, once again, to be with our partners here at Prevention Institute, and I want to introduce you all to Alicia Somji. And Alicia, I'm going to turn it over to you and let you introduce the rest of the Prevention Institute team. But thank you so much for being here and facilitating this for us.
Thanks, Ashley. I'd like to introduce Lisa Fuji Park, sorry, I said your name today. And I'd also like to introduce Ali Goodyear, who is our web tech today. Ali, want to say hi?
Hi, welcome.
Hi, everybody. So I'm really looking forward to diving deeper into a conversation about connecting the dots among multiple forms of violence. And those of you who have been part of Prevent Connect before, you know that we run this like a radio talk show. So there's going to be a lot of back and forth, and we really encourage you to all participate through the text chat. So I'm going to start off by going through our objectives for today. So we will be referencing the Center for Disease Control and Prevention's research on addressing multiple forms of violence. And then once we do that, we'll look more at shared risk and protective factors and how they're informing local and state strategies. And our guests today are going to help highlight the work they're doing. We have a guest from Colorado and another two from North Carolina. And we will also be exploring examples of multi-sector work to prevent sexual and domestic violence as well as other forms of violence concurrently. So to start us off, I want to point you all to this publication that was released in 2014 by Prevention Institute and the CDC. And it's a document on how multiple forms of violence, whether it's sexual violence, domestic violence, child maltreatment, suicide, community violence, etc., have shared risk and protective factors. And it really highlights the research behind that. And the purpose of it, was to highlight those risk factors so that we can help practitioners in their work to prevent violence from occurring in the first place. Then, in this past summer, actually, in summer of 2016, the CDC released a document outlining their strategic vision for connecting the dots. And in our 2016 Prevent Connect series, we actually had a session on shared risk and protective factors, where we had Dr. Linda Dahlberg from the CDC who went into detail about the strategic vision. So if you do want to learn more about that, I invite you to go back and to watch that recording of last year's session that we had. So I would like to ask all of you a text chat question, and please use that text chat on the right side of your screen to respond. We want to know, have you used Connecting the Dots or CDC's strategic vision, and how you've used it, whether you're in the initial phases of trying to connect with those focused on other forms of violence, or maybe you're working on a needs assessment. We'd really love to hear from you, no matter how big or small the progress that you've made has been to date. So please use the text chat, and we'll come back to it in a few minutes. What we've learned so far from Connecting the Dots and research on shared risk and protective factors is that different forms of violence affect people across the life course. So some forms we see during certain periods, but we see them kind of connect throughout. So for example, intimate partner violence, sexual violence, and those who have experienced stalking often experience these forms of violence for the first time in childhood or adolescence. Also, we know that women and girls are particularly vulnerable to sexual violence and suicide assault attempts, while men and boys experience higher rates of suicide and firearm-related assault and homicide. In the CDC strategic vision, it also talks about how LGBTQ and populations with disabilities are vulnerable to multiple forms of interpersonal violence and suicide. And we also know that racial and ethnic minorities are disproportionately impacted by multiple forms of violence across the life course. So in terms of the linkages between multiple forms of violence, we know that they're experienced together, share common underlying factors, result in common outcomes, and also that one form of violence increases the risk for further victimization and engagement. And that last slide where we saw kind of the connections across the life course kind of highlights that as well. So what are some of the specific factors that relate to multiple forms of violence? Our guests today are going to be honing in on some specific factors that they're focused on through their work and how they identified them based on both community need and the research. But if you do take a look at the Connecting the Dots document, you can see how some factors, such as ones at the societal and neighborhood level, such as norms supporting aggression or low neighborhood support and cohesion, really do cross multiple forms. And so we can address them by, working on these factors in our work. We see the same thing for protective factors. So, things like social cohesion, coordination among services in community agencies also are factors that research supports as crossing multiple forms. So now that we know a little bit about the research, why should we really focus on risk and protective factors? What's the real benefit of it? So we started to learn some things from our guests during the 2016 series. For example, one of our guests working in Kansas shared how looking at shared factors gets us to think beyond just programmatic interventions and gets us really to think about things at a community level and changing our community environment. We also learned from our session last season about how shared risk and protective factors provide indicators to examine beyond just rates of violence, which can take a long time to see change. So I'd like to now turn it back to Ashley, Lisa, and Meghna to really share what's coming up in the text chat.
Thanks, Alicia. This is Meghna here. I think about half of our guests have used these resources, so it's exciting to know that. And those who have used it, some of them have mentioned about applying it for violence prevention grants or program implementation. Some have encouraged the others to use these resources. Like, for example, I think some of them have mentioned about strengthening partnerships across different health and violence outcomes. Megan Crouch has said that they have expanded their Teen Alliance Council mission to include substance abuse prevention, which means dating violence prevention and sexual assault. There are other attendees. For example, Lori Hart has mentioned that they have used it extensively at the state and local level in Kansas. And they're also looking at the connections between sexual violence and chronic health conditions. So there are these recurring themes about connecting sexual violence with health equity and health outcomes.
Great, thanks for sharing, Meghna. And I really like the conversations about health equity because I think this next section really ties into that. So we can really see how shared factors helps us think more upstream and consider the real world context. So turning back to this image that I've actually shown every web conference this season for those of you who are returning, we can really see the interplay between structural drivers which have to do with the unequal distribution of power and community determinants for different forms of violence. As the quote on the right reads, the different forms of violence, symbolic, structural, and interpersonal, are not mutually exclusive. Rather, they relate to one another as they manifest. So one way to think about structural drivers and these community factors, shared factors across multiple forms, is to look at maps. So I'm going to share with you an example of Alameda County in California. And we can see here, if you look at the top left-hand side, I'm going to circle it here, you can see kind of the inequities and poverty being in a specific area. And that also being the area where we see communities of color, which is also the same area where we're seeing assault-related injury emergency department visit rates. So we can see that the highest concentration are kind of in similar areas. And then again, when we look at partner assault emergency department visits, again, they're concentrated in the specific areas. So we can see that areas that have high levels of poverty and communities of color are disproportionately affected by multiple forms of violence. What we started to learn about shared factors are that they relate to other health and safety outcomes and inequities that we see in our communities, as we can see here with the Alameda County example. So by addressing them, and by them I mean the shared risk and protective factors, we can really start to push back on larger structural drivers and truly work towards promoting equity. Now, before I turn it over to our first guest for today, I'd also like to highlight the CDC's technical packages. So these provide strategies and approaches to prevent different forms of violence based on the best available research and evidence. Currently, there's ones that are out for sexual violence, child abuse and neglect, suicide, and youth violence. And we also know that there's one in the works for domestic violence. That should be coming out shortly. And because today we are talking about shared risk and protective factors and connecting the dots, I really encourage you to look at some of the packages that may be on a form of violence you're not directly working on, because there may be some ideas in there or factors that you're trying to address in your work where there's strategies, but maybe not the evidence yet to be focused on it for sexual or domestic violence. And we can start to bridge some of those research gaps. So be sure to check those out. Now I would like to introduce Danielle. Danielle, can you just say hi? I want to make sure that I've got you here.
Yep, hi everyone.
So Danielle is going to share with us today how Colorado is looking at shared risk and protective factors through her state-level work. Danielle is the Sexual Violence Prevention Program Manager at the Colorado Department of Public Health and Environment. And as a public health professional, she's worked on a variety of projects in partnership with both government and nonprofit sectors. And she brings experience in community mobilization, grant development and management, training and technical assistance. And in her current role, she manages Colorado's Sexual Violence Prevention Community Grant Program and works to build stakeholder capacity in using shared risk and protective factor approaches for effective violence prevention. So Danielle, I see that you have a strategic plan. Colorado has a strategic plan through injury prevention and mental health promotion for 2016 to 2020 that connects multiple forms of violence. And just wondering if you can share with us you know, the story behind it. How did you start this strategic planning process, and how did you arrive at examining shared risk and protective factors?
Yeah, absolutely. So this is sort of an image of our front cover of our strategic plan. But in Colorado, this is something we just worked on and completed this past year, but was a really, really long time coming. As a branch, our Violence and Injury Prevention Mental Health Promotion branch, we work with several different health outcomes in addition to sexual violence. And so for a while, we've been working and invested in shared risk and protective factors and utilizing that as an approach to connect all of our work in really tangible ways. So we've been invested as a branch for probably about 10 years. And over the years, we've kind of tested or piloted different ways to apply the approach and really connect our work. And so after a really long and extensive amount of time of sort of identifying best practices around this, we finally got to a place where we were able to create sort of a real strategic plan about how we plan to move forward in doing this. And so the real goal was moving sort of the theory and the research into practice and looking at what does it look like when we intentionally connect things like sexual violence to suicide, to bullying, to child fatality. So in developing our strategic plan, the next two slides talk a lot about criteria, but basically, as I mentioned, this is an approach we had been utilizing or attempting to utilize for several years. And in doing that, we kind of developed quite a bit of best practices around how does this work best and sort of what needs to be in place to ensure that we can really meaningfully connect all of our work. And so the pieces we came up and criteria we identified around that was existing and potential momentum, political will to prevent violence and injury. These are often tied together within the state system. Availability of funding, as well as sort of that flexibility and ability to leverage funding sources across programs. And then priorities and critical target areas that were identified by our stakeholders and partners throughout the state, as well as actually having evidence-based strategies that we could utilize to better understand what the connections are between our work. So through these best practices, we identified, although in reality these critical areas that are listed on this slide are actually what live within our violence and injury prevention mental health promotion branch. So we work on suicide prevention, prescription drug overdose, older adult falls, and the list goes on, but is inclusive of our sexual violence work as well. And so our goal was really to line up how do we connect all of these in a clear way using shared risk and protective factors. And then something just to note is that we all, each of our health outcomes, we identified sort of goals that we were interested in meeting through this approach and through connecting our work. And so for the sexual violence program, we really selected these outcomes, which is looking at percentage of youth experiencing forced sexual intercourse or victimization through teen dating violence. Both of these data points we currently are able to access through a statewide health survey that we put through that surveys middle and high school students throughout the state, and so that's been really valuable. A direction that we're hoping to move in the future is that we are really fascinated with the idea of preventing first-time perpetration, and so really utilizing perpetration data to better understand what kind of risk and protective factors are inherent into increasing or decreasing risk of perpetration. So a reality around that, unfortunately, in Colorado is that we are really limited in data. And so we're working right now in exploring different ways to capture that, to add sort of a prevention and victimization piece to our goals.
Thanks, Danielle. This all really makes sense, and it's great to see kind of a systematic process that you all went through to, come up with a set of criteria, identify critical areas to work within, and then set goals. And, from what I understand, the next step is kind of what led to identifying risk and protective factors to address. So before I ask you about what specific shared risk and protective factors you're working on, I also want to ask another text chat question for all of our participants today. So for all of you participating, turn to the text chat and love to hear from you. What factors are you working on? What forms of violence are you addressing? And we'll come back to this in a few minutes. But Danielle, while people are writing, can you please share what risk and protective factors your team has been focused on?
Absolutely. So in developing our strategic plan, I think a good amount of time was really dedicated in identifying risk and protective factors that we could show were connected across all of our health outcomes. So the 5 that we ultimately settled on were connectedness, positive social norms, good behavioral health, economic stability, and resilience. And a key thing around this is we talk about risk and protective factors, and risk factors historically have gotten, I think, a lot of research and a lot of conversation, but oftentimes we don't include conversation and strategies around protective factors. So our branch very intentionally chose to frame our 5 priority factors from a protective area, and so our interest is really in promoting these 5 pieces. And this kind of gives you, it's a little small, but it gives you an idea of how we're understanding and defining a lot of these factors. So for connectedness, social norms, and each. And what you will see is a couple things to note about this is that there is a mix of sort of risk and protective within how we're measuring these. A lot of it was really around how we were intentionally framing. As an example, you will see poor neighborhood support and cohesion versus coordination of resources in the connectedness piece. Additionally, and also very intentionally, you can see that we have identified measures or indicators, I suppose, for each of these factors that are across the socio-ecological model. So you will see some that are specific around promoting a factor for an individual or for a relationship versus promoting factors for an entire community or society level. And the reason we did this is largely that research has shown that prevention is most effective when it crosses all domains. And so we really wanted to ensure that we were really thinking comprehensively as we identified and implemented strategies across our programs, that we were doing it in a comprehensive way that impacted each level of the socio-ecological model.
It's great to see that you're really thinking about the whole picture of things and looking at multiple levels from societal and community all the way down to individual within each factor. And it's really great to see how you simplify this by having, the kind of buckets of factors and then looking more specifically at indicators within each. So I'd love to hear what's coming up in the text chat, and let's share that out.
Hey everyone, this is Lisa. So I noticed that most folks are talking about the different forms of violence that they're trying to address in an integrated way, so that's great to see folks really moving in that direction. Not a lot of people spoke specifically about the risk or protective factors across those forms of violence that they are addressing, although a couple of people mentioned norms, particularly gender norms, and some protective factors like connectedness, social mobility, economic stability, social capital. Also, it's interesting, I'm guessing that in talking about different forms of violence, folks are really making a point that exposure to different forms of violence increase risk for the other forms of violence. So there is, in a way, that community violence is a risk for other forms of violence, et cetera.
That's great. Something else that I'm seeing in the text chat is connecting not only to other forms of violence, but also to other issue areas. So I see something along the lines of addressing homelessness as part of being a risk factor, but also another issue area. And so this reminds me of a conversation we had last month on, connecting with other social movements and social justice work. And if you do want to tune into that web conference, if you wanted to tune into that web conference but weren't able to, we can definitely share the link to the recording to learn more about connecting with other issue areas. So to give our participants a better sense of what your work looks like on the ground, Danielle, can you give us a specific example of a strategy that you're all doing in Colorado to connect the dots and address shared risk and protective factors?
Yeah, absolutely. So we have a few, but I think our best example is the work that we're doing with Sources of Strength. So for those of you who may not be familiar, Sources of Strength is an evidence-based suicide prevention program. It is done in schools, and it is a little unique in that it doesn't have sort of a set curriculum, but is really about building peer leaders who help inform and educate others within the school. And a piece of that which makes it particularly unique is it's pulling young people from basically different social cliques and identifying influencers. So not necessarily the young people that are always involved in the school programs, but really those that represent who influences other young people within the larger school. And it's really based about sort of promotion, so promotion of protective factors, specifically connectedness for young people to feel connected to their school, as well as young people to feel connected to caring adults, and in this case, largely teachers. So it's really fantastic in that it's really taken a positive outlook in how to do this. And this was a program that was identified actually by our Office of Suicide Prevention as a priority program for them. But once we realized that the goal of the program was really focused on promoting factors such as connectedness and youth-adult connectedness that were shared with sexual violence, so both of those protecting and decreasing risk for sexual violence perpetration, we decided that there would be some potential to connect this and use this as a sexual violence strategy. So this is, has looked differently, has expanded in different ways. But the big piece is originally when we started this project 2 years ago as a pilot project, and we were able to braid funding and leverage funding from our Office of Suicide Prevention as well as our Child Fatality Program, which is a sort of a unique opportunity that using a shared risk and protective factor approach provides. And so we braided that. We implemented it in 7 high schools throughout Colorado. And again, the theory was that you can implement a program that's really promoting protective factors and see impact on a wide range of health outcomes, in this case, suicide as well as sexual violence and likely other things such as bullying or substance abuse. And in doing that, we've had a lot of success in the project and getting sort of buy-in and engagement, as well as we found a lot of good success in partnering with our respective internal partners around this. And recently had an opportunity to actually expand this project. And so starting this fall, we are starting a rigorous evaluation in 24 schools throughout Colorado for the next 4 years, which will actually evaluate whether or not we can use sources of strength and show that it'll have impact on sexual violence in addition to suicide because we're building these protective factors. Yeah.
Thanks, Danielle. I know we also have this slide. Do you want to explain what this is? Oh.
Oops. Yes, this one?
Yeah.
Yeah, so this is just sort of the wheel that's used at the core of sources of strength, and it's the pieces that they identify and work through with the students. So again, what's unique about the program is that it's a very positive lens, and it's also taking sort of a holistic view of what influences young people and sort of needs that young people have. And it's interesting, too, because it doesn't necessarily talk about suicide regularly. So young people know it's a suicide prevention program, but it's really focused on talking about friends and mentors and healthy behaviors and help seeking. And it's talked about much more broadly than just suicide prevention.
Thanks, Danielle. We do have some questions in the text chat, and I'm wondering if you could maybe help answer them. One is, how do you identify the influencers in a school?
Yeah, so this might answer a question later on. Sources of Strength actually does all of the trainings in schools and have developed really great relationships with the individual schools. And so they're probably a better contact in terms of how they do that work. But a piece of it is that they also train adult advisors. And so they bring teachers and other adults within the school and they train them on sources of strength. And then those individuals and the other teachers in the school will nominate students that they feel are influencers.
Thanks for taking that question. I know that was hard answering on the spot, but there is one more that I think maybe relates to what you just said. We have a question about if Sources of Strength is available to other communities.
Yes, so they actually operate across the U.S. and I'm pretty sure internationally as well now. So you can look up Sources of Strength on their website and get in contact directly, and I'm happy to pass that information along too.
Great. And if participants have other questions, feel free to put them in the text chat. We can try our best to get to them. But I do want to ask you 2 more questions, Danielle. So first, we also know that multi-sector partnerships are critical to addressing a lot of these types of risk and protective factors. So I'd love if you could share with us who some of your partners are. And then also my second question is about what the benefits are to working across multiple forms of violence, or what difference has this approach made in your work?
Absolutely. So we have several partners, especially through some of the more recent work we've been doing. So we have our sort of traditional nonprofit grantees, And then we are starting to work much closer with the Colorado Department of Education and have utilized their support and partnership in the recruitment of schools for the Sources of Strength project. And it's been a unique partnership in that it has allowed us to sort of build our expertise on how to talk about sexual violence and probably more importantly, risk factors and protective factors that are actually shared with educational outcomes. So when you think about what protective factor, what might protect someone against perpetrating violence may also be something that increases their ability to do well in school. And so that has been a unique opportunity for us. Additionally, Colorado Youth Matter is a youth serving organization, advocacy organization in Colorado, and that has been a unique partnership as well. They do a lot of work with comprehensive sex education, and so we've been working with them to help to sort of leverage the work that they do to help institutionalize comprehensive sex education within Colorado schools. And sort of our thought process around utilizing that as a strategy is largely that comprehensive sex education curricula often offer skill-based pieces that help and promote young people and promote skill development. And so we see that sort of as an upstream or more upstream approach to impacting sexual violence in building these skills such as communication skills or conflict management skills. And then we also have partnerships through Human Services with other similar granting and funding agencies, as well as our Colorado Coalition Against Sexual Assault here. And again, shared risk and protective factors offers an opportunity to find ways to talk about what you are passionate about and what you work towards with other people in a way that's meaningful to them. So we work a lot with prevention, and our coalition works a lot with intervention, and we use shared risk and protective factors as a way to communicate across our different programs. Great. And then
I'd love if you can share the benefits to working across multiple forms of violence and kind of what difference the approach has made in your work.
Yeah, absolutely. So this is just another picture pulled from our strategic plan that I'm not going to spend too much time going through, but a big piece of it is really understanding where funding is coming and where priorities are at for different agencies around different health outcomes. And this just really helped us strategize around how can we braid or leverage work that was happening throughout the state with internal and external partners. So as an example, there's oftentimes very limited funding. And so utilizing the shared risk and protective factor approach has really, really helped us in sort of leveraging that. So similar to what I was speaking about with the Sources of Strength project, we were able to utilize funding from both our sexual violence funding as well as suicide funding as well as child fatality funding and bring it all together for one project. So it really allows for potentially for a larger reach as well as for more programming or strategizing across different levels of the socio-ecological model. And then there's also alignment of resources and alignments of asks. I'm going to talk a little bit about this later in the presentation, but we have an internal work group that's really focused on understanding that we have a lot of shared stakeholders and grantees and partners. So how do we align our asks of those individuals and align the resources that we're providing them or that are coming from them in a way that helps us move the work forward to have a stronger reach and a broader reach across different health outcomes. And then lastly, I think it really allows for creativity. I think we found in sexual violence that there's not tons of research out there, especially around evidence-based programs. And so using a shared risk and protective factor approach really allows you to get creative about how you think about preventing sexual violence. And so I think a good example around that is that we have an Essentials for Childhood grant here in Colorado that's really focused on policies associated with early childhood and economic opportunity, such as family-friendly policies in businesses. And so we've started really talking about how do we look at this, knowing that economic opportunity is a factor that impacts sexual violence. how do we take the strategies that our early childhood or Essentials for Childhood program is doing and incorporate that into our work and sort of increase our ability to see impact from that.
Thanks, Danielle. And I just love this table that you have here because it really shows how things are being braided together and really implemented in a strategic way. So I'm going to turn it over to Lisa for a moment.
Yeah, so I am also really appreciating everything that you're sharing, and congratulations for moving so many connected pieces forward in such an organized fashion. So I had a follow-up question based on what you've shared so far. And it's an issue that I have heard sexual and domestic violence prevention folks bring up as a concern in moving towards the shared risk and protective factors approach, which is the notion that sexual and domestic violence is linked but distinct from other forms of violence, and that there are specific aspects of risk and protective factors that relate to sexual and domestic violence that, if they are not distinctly addressed, could kind of get lost in the picture. So just looking at your sources of strength example, protective resources like family or spirituality or peers, if they aren't addressing the specific ways that the specific things that contribute to sexual and domestic violence, such as harmful gender norms or limited definitions of masculinity or femininity, or or even just not even acknowledging or addressing the reality that young people have intimate relationships and need support around their skills and attitudes around gender and sexuality and intimate relationships. If those things are omitted or not kind of specifically addressed, in a way, are the specific sexual and domestic violence issues getting overlooked in that process? So that's a concern that I've heard addressed. So I'm curious about if you have reactions to that. And I also just want to acknowledge that clearly in your overall strategy, there are very specific things that I can see on this slide that do relate specifically to sexual and domestic violence. So just curious about those strategies that, like the sources of strength, that are kind of aimed at addressing multiple forms of violence all at once.
Yeah, absolutely. I think that's a good and valid question. I think part of our research study is really hoping to identify some of that, in that, what makes this, in this case, sources of strength, what of this program is effective around sexual violence and what isn't. I think there's, this is definitely a theory, a pilot, a hypothesis that we're testing, and we want to learn more about, how do we incorporate what's being done in other programs, and then what is necessary in terms of that sort of content piece around, or nuances around, sexual violence, domestic violence. I think also, though, that being said, sources of strength is just a single strategy, and as I mentioned before, we're really invested in leveraging strategies across the socio-ecological model. So ideally, when you have sources of strength happening, you also have policy change happening within that community around gender norms, for example. And I think the piece of that is also recognizing that, policies, for example, that we tend to associate directly with sexual violence and domestic violence, perhaps there are others that are still informing gender norms that are different and allow us, I think this political will piece is really important for us. Some things just don't move. So what kinds of policy pieces as an example, and how can we think about it more broadly? So as an example, family-friendly business practices, we consider that sort of a child maltreatment prevention policy, but arguably is also a positive gender norm policy. So I think it's really about utilizing a comprehensive approach, and hopefully through the Sources of Strength project, we can better identify what pieces are really effective without the nuance, and what pieces maybe aren't.
Great, thank you.
Yeah. And I love that you're highlighting the need for comprehensive approaches, because, when we see these web conferences and we see a specific program, being highlighted, it's important to remember the greater context that, it really does take a comprehensive approach across different levels of not just educational or school-based programs, but thinking about policy and other levels at the same time. So I really appreciate that you're highlighting the complexities, but also sharing how you've looked at the specifics of individual programs and connected it back to your larger strategy in the state. So thank you so much for all of that, Danielle. We're going to bring Danielle back at the end to share challenges and tips in a little bit, but I'd now like to head over to North Carolina. Can I get a quick hello from Dina and Allison?
Hi.
Hello. Hello.
Hi. So Dina is the prevention coordinator at the North Carolina Coalition Against Domestic Violence. She manages the coalition's Delta Focus grant, overseeing the planning and implementation of state-level primary prevention strategies that address shared risk and protection at the outer layers of social ecology. Before joining NCC-ADV, Dina worked at the California Coalition Against Sexual Assault, providing training and technical assistance to local practitioners and to support the rape prevention and education programs across California. And Allison is the Senior VP of Resident Safety at the Charlotte Housing Authority. He's been working with the Housing Authority for over 16 years and is also a former police officer. Allison has a true commitment to the community, serving on the Violence Prevention Task Force with Mecklenburg County, Teen Dating Violence Awareness Committee, and also on a Men's Empowerment Coalition. So Dean, I'd like to start off with you. I know through Prevent Violence North Carolina, you've all been prioritizing risk and protective factors. Can you share a little bit about what Prevent Violence NC is and what the prioritization has looked like for you?
Absolutely. So Prevent Violence NC is actually a website, so preventviolencenc.org. And it's a website that has a lot of different resources for local practitioners across North Carolina to figure out how to actually do work focusing on shared risk and protection. And it gets a little more specific than that. But I think it's also a great model for folks beyond North Carolina. The examples of programs are all drawn from North Carolina, but they are applicable elsewhere. And also there are a lot of great resources, including links to existing research and programs out there, as well as sort of the theory of why focus on shared protection, really. So just a couple notes about what you're seeing on your screen. So the two premises of the website are, of course, that violence is preventable and that many forms of violence share common influences. So this is clearly in alignment with connecting the dots and the focus on shared risk and protection that the CDC has. And like Danielle's project, we were really focused on growth and strength. And when we talk about growth, we talk about growing protective factors, but we also talk about growing our understanding of what violence prevention looks like and who our partners can be and what prevention really means. And so a little bit about the process of how Prevent Violence NC came to be. In about 2009, the North Carolina Department of Public Health Injury and Violence Prevention Branch came together with my coalition, the North Carolina Coalition Against Domestic Violence, as well as the North Carolina Coalition Against Sexual Assault and some other agencies, and they really wanted to figure out a way to maximize the impact of their limited resources, sort of similar to what we've been hearing already today. And they prioritized 5 types of violence, which are 5 of the 8 that are in Connecting the Dots. And we started at the Coalition Against Domestic Violence looking into the literature and seeing what was already out there about what risk and protective factors were connected to each of these 5 forms of violence. And we created a matrix with these, and around the time that we were getting ready to really develop the website and release it was right around when Connecting the Dots came out. And fortunately, Connecting the Dots said a lot of the same things that we were seeing in our matrix, so that really confirmed what we had been seeing in the literature as well. So based on those shared risk and protective factors that we found and that were in the Connecting the Dots, we came up with 5 key strengths. And so Prevent Violence NC is organized around these 5 key strengths. Each one of them has sort of a theoretical background, a description of what the key strength really means, some supporting evidence, resources specific to that key strength, programs specific to that key strength, and case studies for each key strength, as well as a map of where folks are focusing on this in North Carolina. So our 5 key strengths are healthy social and emotional development, parent-child connectedness, school climate and school connectedness, community connectedness, and employment stability and economic opportunity. And we are also in the process right now of adding a 6th key strength, which is gender, equal status of women, and potentially gender equity, although the research that we were able to find and our criteria where we wanted to have research on thoroughly, rigorously evaluated programs specifically focused on that key strength. So we couldn't find much research that supported gender equity the way we were defining it, which was sort of beyond the binary. Most of the research was about men and women. So really equal status of women was the closest we could find to that. But anyway, that's about to be added hopefully this summer to the website in addition to these 5 key strengths.
Great. I think that's a good overview of the factors in Prevent Violence NC. Now I know when you start working across multiple forms of violence, and especially when you're addressing community level factors, multi-sector partnerships become really important. So I would like to ask a text chat question. Who are some of the unusual partners that all of you have started working with to address multiple forms of violence, and what are some of the barriers that you've seen in collaborating with them? So I know some of you have already said that you started focusing on different forms of violence. I'd love to hear from you about who your partners are in that work. And I'd like to pose the same question to you, Dina, and then we'll come back to the text chat to see what everyone is saying. So can you please start us off by sharing what priorities or shared factors arose locally in Charlotte, and then tell us about some of the local partnerships that have emerged?
Absolutely. So this is Charlotte, North Carolina. This is my hometown, and this is where Allison lives as well. So I'll talk a little bit about the process of how, who was identifying priority risk and protective factors and how that came to be. So in Mecklenburg County, they did a community health assessment, as communities across the country do, and they identified 4 priority areas to focus on, one of which was violence prevention. And the health department there was asked to come up with a coalition of folks to reduce risk factors and increase protective factors for violence. And that was as specific as the guidance got. So the coalition came together to really figure out what it meant to focus on reducing risk and increasing protective factors and how to do that. So it's a coalition of about 20 to 30 members of all sorts from all sectors, including like emergency department doctors, epidemiologists, faith leaders, community leaders, service providers, sort of DSS, but also nonprofits, et cetera. So it's a pretty broad-based coalition of both service providers and community members. And my colleague Jen Counts and I started providing trainings to them last December on Prevent Violence NC and on shared risk and protective factors. And we worked with them to sort of prioritize what risk and protective factors were most important in their community. And we used the Connecting the Dots risk and protective factors as a starting point, and then we asked them to prioritize based on importance in Charlotte in particular, and changeability, and not just changeability theoretically, but what could this coalition actually accomplish. And they sort of sorted things into a grid like this, and we identified that things that were important but not very changeable could be a moderate priority because there's obviously a potential for high impact. But this is really where you had to be innovative, because when things are hard to change, it's usually because there's not, or sometimes it's because there's not a robust evidence base there. So you get to be innovative and develop your own strategy. If things that were a little less important but more changeable could also be a moderate priority because maybe there was minimal effort there, although there was low impact. But we were really looking for those high importance and high changeability factors. So unfortunately, a lot of the things that were most important were not as changeable, poverty and lots of entrenched sort of policies and structural determinants, right? But we also identified community connectedness and coordination of services and resources in Charlotte. A very common theme that came up in this coalition was that Charlotte feels very fragmented. Often service providers have no idea what other service providers there are in the city, really even the next zip code over, and that sort of feeling of fragmentation is mimicked at the community level as well. Folks know their own community pretty well sometimes, but sort of stay in their part of Charlotte. It's pretty segregated, and I believe, and Allison can verify this for me, but I believe Charlotte was ranked worst in the country for social mobility. So there was really, so there's this really strong lack of connectedness. And that coalition of 20 to 30 folks from Mecklenburg County is still sort of in the process of taking these priorities and coming up with strategy and coming up with program plans. But also, partially out of that coalition, a partnership formed between Community Support Services, which is one of the local domestic violence service providers, and the Charlotte Housing Authority, which is where Allison works. So I'd love to, I think, Allison, should we hear a little from you or text chat?
Maybe we can hear about what other partners are coming up in the text chat, and then we'll turn it over to you, Allison. Love to hear more about what you're doing. So let's hear what's happening in the text chat.
Yeah, thanks, Alicia. This is Ashley. A lot of folks are partnering with faith-based communities. There was someone who said a local business bureau, bartenders, housing authorities, hotel managers. So there's some really great kind of quote-unquote unusual partnerships that folks are engaged in. And I think the barriers are really interesting because a couple people have talked about language. So either that we use different language to talk about our respective issues, but also sometimes, depending on who we're trying to work with, we have to modify our language to kind of get folks to hear us and to hear our message at first. And I think someone pointed that out specifically with faith-based communities. And then also some other barriers, cultural and religious perspectives, have to be taken into account when you're working in different communities. I'm sorry if someone can't hear me well. But yeah, so those are the things that I saw coming up, Alicia.
Thanks, Ashley.
Of course.
So I'd like to now turn it over to you, Allison. So I've heard that you're quite the champion in the housing world when it comes to the project that you're doing with Dina and domestic violence prevention. So I'd love to hear from you how you got interested in shared risk and protective factors, and specifically domestic violence prevention.
Well, I think probably because of my background as a police officer in the early 90s, and particularly in Columbia, South Carolina, working with the Columbia Police Department. One of the biggest things that we saw was the inability of residents and community to communicate effectively without chaos or crisis. And from that standpoint, we got a chance for us to look at what can be done to address the risk of protective factors and improve the protective factors, shared protective factors to help those individuals out. For the last 16 years, as Dina was mentioned, I was part of the with the Charlotte Housing Authority, and it was that in my current role that what we do is we look at and monitor the crime stats on a monthly basis that is shared by the Charlotte Mecklenburg County Police Department. And through those sharing of those crime stats and monitoring and evaluating those crime stats, we noticed that there was one key area that is always categorized high in every single community, and that's over 27 housing communities throughout Charlotte. And that is non-aggravated assault, which deals with the domestic violence and residents' inability to communicate effectively without crisis. So because of that, they got a chance to look at that deeply. And then when I was asked to visit the task force meeting, and when I was there at the task force meeting, I realized that we were missing at the table. And by being missed at the table, there was a voice that wasn't being heard. So I utilized my position as a way of sharing the thoughts and the concerns of the residents of the public housing community, and then listen to Dina and Jennifer, who are her partner involved with their coalition. I thought it was an exciting opportunity and something that the Housing Authority can look into.
Thanks, Allison. It's so great that you were able to come to the table and start working together. So I'd love to hear more from both of you now about what you're specifically doing at the Housing Authority to address shared factors, what factors emerged, and what specific activities you're working on.
Well, one of the things that we noticed, and I pushed out, was our residents' voice wasn't at the table, and we were not getting their input and their guidelines. We were doing programs around the country, and most people have the same problem. We would do programs, but we were looking at the programs from the practitioner's eyeglasses, not necessarily the lens and the experience from the people who were impacted the most. So what we did was we went ahead and started getting involvement of the residents and saw that it was very important for them to be engaged at the very beginning to get their input so we could develop a curriculum that will address the needs of the risk protective factors within the community.
Yeah.
And Dina, can you share?
Sure, yeah. So Allison obviously has a lot of expertise in the Charlotte community and has access to lots of community groups of the folks who actually live within the Charlotte Housing Authority communities. And so we definitely wanted to lift up the priorities that he was reporting to us, both sort of from his observations and from what the communities were telling him. And so we sort of identified together that cultural norms that support aggression towards others, coordination of resources and services among community agencies, poor neighborhood support and cohesion, and community connectedness were major priorities in these communities. And if you'll notice, those really echoed what we were talking about at the larger Charlotte level. So hopefully when the broader coalition has more clear strategies and programs, it'll be pretty in line with what's happening at the Charlotte Housing Authority. And once we identified these priorities and also some activities, the North Carolina Coalition Against Domestic Violence was able to provide a mini grant to the Charlotte Housing Authority out of our Delta Focus funding, both to support their programming but also to support evaluation. And with the evaluation, we're partnering with a local professor who works at the Johnson C. Smith University School of Social Work to evaluate the program's impact on shared risk and protective factors, and specifically these prioritized factors, as well as a couple other outcomes. And a little bit about some of the programmatic work that's happening, and I hope you'll notice it's happening at different levels of the social ecology as well. So I'll just give a quick overview, and Allison, if you want to expand, feel free.
Okay.
But so there's bystander trainings for the resident community leaders, as well as staff and vendors, and all of the residents at Charlotte Housing Authority sites. There's also a new system-wide policy that requires staff to get trained in response to and recognizing and some basic sort of trauma-informed information about domestic violence. There's also community meetings and resource referrals within 72 hours of whenever there's a public violent incident in one of the sites. And at those meetings, they do some group processing and also refer to relevant services and resources. And then there is a youth sort of community social marketing campaign where the youth are coming up with messages about what safe families and safe communities look like and sort of their vision for a positive, safe, connected community. So Allison, feel free to expand on any of those.
Sure. Particularly with the training process, what we realized and noticed that property managers really did not have the ability to address domestic situation when they confronted them. Here at the Charlotte Housing Authority, we have what we call a client service department that work alongside with the property management department. So what we did was use a tag team approach to make sure that each vendor, as well as client service department and other third-party client service vendors, have the same training and understanding of what domestic violence looks like, how it's impacted by the victim, and how that can impact the community overall when it's not being addressed. And then we talked about the underlying factor of violence within the community. And you deal with, if you could deal with the violence at the intimate level as it relates to, the relationship between partners, as well as the relationship between next door neighbors, if those are addressed then they address the overall issue of crime within our community. From that standpoint, we thought it was important enough that each member have that training. And then the other piece was to involve the resident to be part of that training, as I mentioned earlier, to also be part of the training as well, and to be part of the curriculum development of that. So the staff from the Community Safety Department with Mecklenburg County conducted those series of workshops with the residents, and now we start training residents in various communities that can be addressed the issue of violence, domestic violence. The other key is if a violence occurs within the community, we have a partnership with the Carolina Healthcare System and Injury Prevention Coordinator with the Trauma Institute, that they come out at each time of a violent situation and do a debriefing with the community. We have the property managers to call a meeting of all the community members, particularly those young children that would probably get involved or witness the shooting or any violent particular act. when those individuals come, we'll bring them together and have a discussion, debriefing about what was going on with that shooting, with that incident, and to give the chance for the families to digress, digest, and see how important that violence plays a role in the lives of a family or the upbringing of a child. So that was very important. And then the outreach part is for the youth to be able to express themselves in a manner that gives them a chance to give their voice, their opinion, and take that information and turn into a social marketing campaign and utilize that as a campaign of like drug driver campaign with billboards. So utilize those campaigns, and it could be magnets or pencils or keychains for the resident to see, and it's something that they will see on a consistent basis, and hopefully be on their mind to don't just stand by, but stand up and do something about it.
Yeah, and
that's a great overview. Oh, go ahead.
Yeah, I was just going to sort of highlight, so sort of different from what we heard from Danielle, the focus here is primarily on domestic violence, sort of in name, but a lot of the work here is broader than that, and I think that was exactly the purpose of focusing on shared risk and protection. So right. Bystander intervention and also the community meetings is all about changing norms of acceptability of aggression in the community, and so that obviously is connected to multiple forms of violence. And then with these community meetings around really incidents of community violence, that's sort of another way to draw in just beyond domestic violence. And so hopefully building these strengths will not just impact domestic violence, but also beyond.
Yeah, I love that. I think Allison did get in a little more detail about the youth outreach contest and social marketing campaign, but we did have a question about if you could expand a little more about that.
Yeah, what we're trying to do is basically have various communities, young people in various communities. We have different organizations like YWCA, YMCA, Big Brothers, Big Sisters. They have programs within our communities throughout the county. And since we have the young people at the table and have a captive audience, our goal is to create a awareness and discussion around violence, because the young people witness violence inside the homes on a daily basis, and how are they impacted by it. So we want to give them opportunity to be able to express their feelings, and they can do it through the form of words, art, displaying art on paper, or whatever ways and means that they can express themselves. And by doing that, we want to capture what they've done and possibly maybe create what they've created, turn that into a marketing campaign piece that it will be shared throughout the community, and then they will give their buy-in, and they feel like they have an input in what's going on within their particular community.
Thanks for expanding. Yeah, I think it's really great to see how these activities are relating to those priorities that you had listed in the other slide. And so, for example, what's coming out, one thing I can think of is how the youth outreach contest and social marketing campaign relates to norms. And I also really like how you're including youth and community voices and the residents throughout the process. So it's great to hear.
Yeah, one other thing, Alicia. We've also been approached by UNC Chapel Hill, social media journalism, School of Journalism, to address that they want to be involved and look at analyzing our communities and look at how can they play a major role in doing that for this semester. So Dina and I went up to Chapel Hill. Well, Dina is in the Chapel Hill area. I went up to Chapel Hill a few months ago, and we met with the class, and just past March 3rd of this year, the students came down to Charlotte to do evaluation at one of their community meetings, and then they got a chance to do some of their assessment. So they're going to be providing some social media campaign ideas for us to follow and to utilize.
That's fantastic to see even more partnerships forming and, engaging the education sector and leveraging those different partnerships and their strengths. So I'd like to ask, where do you want to go next in your work to connect the dots with the Housing Authority and your work in general as well as Dina?
Yeah, so I think there's always more room to engage more systems. I think the more community systems involved, the more coordination there is, the better. And like I was saying earlier with the Mecklenburg County Coalition, there's clearly interest, and there's even a body that already exists to expand beyond systems. So like Allison was saying, the hospital system is already engaged, the local domestic violence service provider is already engaged, and I think we can keep on adding to that and building community strengths based on that. And another vein that we're really excited about at the North Carolina Coalition is trauma-informed work, but not just trauma-informed services. I think that term sort of comes out of the mental health field, and we think about trauma-informed therapy or sometimes spaces, but I think really we can work towards trauma-informed institutions where institutional policy, organizational policy, built environment, the way programs are planned, et cetera, can all be more trauma-informed. So I know we've talked to Allison a little bit about doing some trauma-informed care trainings with his staff in the future, but also sort of broader than that, how can we make all of our policies and practices and every part of our institution more trauma-informed.
Great. I do want to move into talking about challenges and tips from all of our guests today, but I do have one question showing up in the text chat here, so I'd like to pose it to you. Is there any work with child welfare system that's going on at the moment?
I know there, from our standpoint, there are some DSS officials at the table, as well as the child support office staff members are part of this task force with Mecklenburg County.
Okay. So thank you both, Dina and Allison, for sharing, highlighting the work you're doing in North Carolina and specifically in Charlotte. I'd like to bring Danielle back into the conversation so that we can talk about some challenges and how you're working to overcome them, because working across different forms of violence, is challenging, and it's not, easy. It's not as easy as maybe working in silos. So I'd like to really hear from you. What are some big challenges that are coming up in your work, and how are you working to overcome them? And Danielle, we could start with you if you're there.
Yep, I'm here.
Okay. I'd like to hear from you what challenges you're facing.
Yeah, absolutely. So I think that we have a few challenges, and I'll identify them and talk a little bit about how we're overcoming them. But one of the biggest challenges is that the concept of shared risk and protective factors is can be really difficult to talk about and communicate in a way that makes sense. And we've personally found in Colorado that a lot of our external stakeholders, and some internal as well, don't have a lot of knowledge around it. And so we're kind of starting at a baseline with a lot of people and trying to explore how do we better communicate and how do we create sort of shared language when we are talking about this. And so some of the sort of, best practices we've started to learn around it and are still learning as we go. But there's a lot of value in having group meetings and more importantly, targeted conversations and one-on-ones with partners. We found sometimes in group meetings it can be hard to get everyone on the same page, and so oftentimes talking about connections, it's helpful to meet someone individually and have some sort of defined ask or an idea that you can present in how your work is already connected to that partner or stakeholder. I think that's really key. I think I've mentioned this before, and I'll probably mention it again, that this approach has a lot of research behind it, but has been very theoretical in a lot of ways for a while. And so how do we get out of that? And I think also, ensuring that there is sort of a foundation around what is prevention and primary prevention, and how does utilizing risk and protective factors keep you in sort of an upstream area when talking about health outcomes. And then lastly, in conjunction, we as a branch have identified this is a challenge. So our strategic plan that came out, we're actually in the process of developing a communication plan around that strategic plan, so that internally all of our staff are sort of prepared and have expertise in how to communicate this to a wide range of stakeholders. So that's something we're doing. Additionally, I think local partners, it can be tough as a funding agency. We work a lot with our grantees around utilizing risk and protective factors, but they often have limitations from other funding sources that require them to work within a much more siloed area. And so from a state level, we've been working on building partnerships with other state agencies that provide funding so that we can better align our requests for proposals and things of that nature and allow some flexibility, while also helping our grantees identify how do they connect the work that they're doing with us to the work that's happening through their other funding sources, and how can they connect, and we being flexible in allowing them to make those connections. And then, like I said, just very theoretical oftentimes. And so we're still learning. I think the strategic plan was one way in which we have taken something theoretical and tried to put structure around it to identify really tangible ways to move this forward practically and in the field. And so some of our pilot projects, like I said, with Sources of Strength, is very much a learning opportunity for us still, and it's truly a research project. And so we're really trying to experiment and learn from it and move forward with that.
Thanks, Danielle. I think the point about connecting the dots seeming very theoretical and moving to action is definitely an important challenge. And I think web conferences like this and hearing about the work that you're all doing really helps make it more practical for other folks that are looking to connect the dots in their work. So Dina and Allison, can you share with us what challenges you're facing and how you're working to overcome them?
Yeah, so I'll start by echoing Danielle. With it being very theoretical, I think it's been relatively easy in my experience to get folks on board with the idea of shared risk and protection, but moving from that sort of big picture to how an individual organization is going to contribute to the work has been kind of difficult. I think especially with sort of larger coalitions, there's always history between organizations and some politics, and so figuring out how to navigate that in a way that enables folks to really contribute at their maximum capacity and in a sort of collaborative and not just coordinated way is challenging, and it takes time, which is why that coalition is still sort of really figuring out the best strategies and programmatic plans. And beyond that, I think the Housing Authority work has been going really smoothly. I think it's just a matter of always bringing the focus back to risk and protection factors in evaluation and in planning. But yeah, I think as long as the program is going well, and it has been, it's really just a matter of sort of emphasis and framing. And I think that challenge has been sort of easier to overcome once we sort of know what partnerships and work on the ground looks like.
Great. Anything to add, Allison?
The only thing I want to add is they make sure that we engage our champions, meaning our residents, to be part of it. And sometimes that's going to be our biggest challenge, our biggest supporter as well as our biggest challenge, because on the first layer, you have residents that want to be involved and be engaged. It's the next layer of residents that you're trying to reach and empower to get active, to be engaged and be active, to take a role in saving and helping and empowering their community.
Definitely. So at the start of this web conference, I shared a slide from the CDC on why to focus on shared factors. And I think this has really been illuminated by some of the work that's been shared today. And so based on the experience that you've all had from the work you're doing, I would like to just ask what tips you have to share with the Prevent Connect community and for those who are wanting to start connecting the dots in their work. So Danielle, can we start with you sharing your tips?
Sure. So like I mentioned previously, I think having a strategic plan has really helped us unify our work and unify our direction, and also understand the gaps that we had internally. So like I mentioned, around communication and how to communicate our strategic plan, I think in developing that we sort of realized we needed more. So I think that's really helpful to think about in terms of a structure for a way forward. We also have had a lot of success in some organizational and policy changes or how we do things. So we have some pretty intentional hiring practices and braided funding for shared positions. So As an example of that, for one thing, when we're hiring, we really look for people who understand shared risk and protective factors. And oftentimes in our interview processes, we include questions that help us get there and utilize that. And so that's a big piece of it. And then additionally, a good example, our sexual violence program actually currently shares a staff member with our early childhood or child maltreatment prevention work. And so that kind of inherently connects because you have one individual that is working on two different outcomes whose aim is largely to figure out how do we make these more aligned in parts. And so that's been really effective for us. And then also really valuing collaboration in our office. So I mentioned this earlier, but we have an internal work group. It's a shared risk and protective factor work group. And so internally we've brought together several people that are working on more programmatic things or cross-cutting issues like positive youth development or family engagement. And we've brought them together and we have a dedicated time each month to talk about how do we better align our work and really make connections around strategies and risk and protective factors of interest for us. And so we've had some really successful things. But I think the key piece is really like providing space and providing time for staff to really connect or to move out of the office and connect externally with partners as well. And then we also include orientation to this and to our strategic plan as part of all of our onboarding. And so that's been really key on getting people sort of started with a strong foundation as they enter in their new positions. And then lastly, shared language, like I mentioned, is really, really huge. And it can be really difficult sometimes, and risk and protective factors are talked about very differently if you are in the education sector or the criminal justice sector or the health sector. And we found that, and even internally we found that across outcomes as well. So when suicide is talking about it versus when sexual violence is talking about sort of the same thing, we talk about it differently sometimes. And so we're currently working on developing branch-wide internal working definitions and measures of these risk and protective factors that we're most interested in that we stated in our strategic plan. So I think a key piece of this too, and a tip around this, is really ensuring that everyone is on the same page about how you're talking about this and what you mean when you talk about risk and protective factors.
Mm-hmm. I really like how you highlighted organizational changes and being really thoughtful about that part of it too, because we often think about, more of the external factors. So I like that that's part of your tips. Let's turn it over to Dina and Allison. Can you share with us your tips?
Yeah, so I'm actually going to start with the middle one, finding champions. I know Allison talked about finding champions within the community who live in the Housing Authority, but Allison himself has been an incredible champion and has moved this work forward both with his community partners, but also within his agency and the hierarchy there, and has been an incredible asset to this work. So I think at all levels it's really important to find champions. Lisa's question earlier about sort of addressing specifics of sexual and domestic violence also sort of got to this notion that sometimes some partners have a desire to hold on to like the identity of their specific issue. And I know sexual and domestic violence in particular came out of movements really. So these weren't, the prevention work didn't originate in sort of a public health atmosphere. It originated as a movement. And so it's really central to a lot of our identities. And I think it's important to frame shared risk and protective factors not as sort of mission creep, but as a way to maximize our impact and broaden our work. And I don't think we have to let go of that identity in order to work with more folks and maximize our impact. And then finally, just sort of back to the idea that moving from the big picture to the actual work on the ground takes some time and takes a lot of sort of back and forth and coordination. And so that often takes a while. So just making sure that you're being realistic about that throughout and that all your partners are sort of on the same page about that.
Yeah, and thank you, Dina. Thank you, Dina, for those kind words. But I also want to, I can't emphasize enough, those individuals that are impacted the most by the work that we're doing, make sure somehow we have them at the table and that they are giving their input as we begin to look at strategies and obstacles, not obstacles, but strategies and goals to address the challenge that we're facing with domestic violence and violence in general within our community.
Thank you so much to all of you. This is a really great session. We're going to end off with just some quick tools and resources to share out, which were discussed throughout today's web conference. We have the Prevent Violence NC link, preventViolenceNC.org, that Dina shared. Also want to highlight Connecting the Dots, CDC and Prevention Institute's research that's been done that could help make the case for connecting the dots across different forms of violence, and then also those technical packages. And it looks like my slide for Colorado's strategic plan is missing, but we'll also include the link for the strategic plan for you to see more in detail what that looks like, and you can read through that. So thank you so much for joining us today. Ashley, do you want to close us out?
Sure. Yeah, I just want to thank you all again for joining us on this wonderful web conference and really, really great conversation. Thank you to our wonderful hosts here at Prevention Institute. Thank you to our amazing guests, Danielle, Dina, Allison. Thank you so much for sharing the work that you're doing. And thanks to our audience for all of the conversation, the questions, the sharing of resources, what you all are doing in your communities. It's just so great to see all the wonderful work and to be able to make connections among practitioners. So we hope that you all have a wonderful rest of your Wednesday. We will be sending out an email when the recording of this session is available, and you'll also be able to access the slides and the text chat transcript in case you missed something or you want to go back and get resources. So look for that. We'll also be sending out an evaluation in about 15 minutes. We would love your feedback, and you will be able to download a certificate of attendance after completing that. And if for any reason you can't, send me an email and I will make sure you get it. But thank you all so much. This ends our session for today. Take care.
Thank you.
Thank you.